Hi, this is Lori Wingard with Home Care Assistance. Welcome to part 2 of a conversation with Dr. David Hinkle about movement disorders and Parkinson's. So thanks again for being here. Let's continue the conversation. I'm a new patient and you have to tell me that I have Parkinson's disease. What does that sound like?
Well, so we talk about the disorder, we talk about what's happening in the brain, we talk about progression and tell them that there's very, very slow progression over years and decades. And, we talk about the fact that there's not a cure, but that people are working on it and that progress is being made. And we talk about the positives too, that you need to get to a gym, you need to exercise. If you're a Browns fan, you're still a Browns fan. If you don't like that restaurant, you're not walking out of here liking the restaurant. You're not changing, leaving. You're a person with this. It doesn't have you, and that there are lots of ways that you can work to maintain your life, and that there are people that can help you with it. And we all also offer a lot of educational opportunities. We've had to reconfigure a little bit with the pandemic, but we have a lot of wellness opportunities, exercise opportunities, and educational opportunities that allow people to talk with us and interact. And we try to be realistic, but we also focus on the positive part of it and make people recognize that it's not their fault, that they didn't do anything wrong. It's not fair, but we all get something. I mean, things happen to us humans as we go through life. And also it's important for them to know that with Parkinson disease proper, the life expectancy, statistically speaking, really doesn't change. That people with Parkinson disease tend to get old and wear out like every other human does. If dementia becomes part of it, dementia is a little bit of a different story, and the curves do change a little bit in terms of survival. But we kind of go through it when we talk about it. And I usually tell people also that I have a large group of 80-year-olds who has had Parkinson's for 30 years who are really missing their high intensity boxing classes for exercise, and that they're some of their husbands are worried because they're getting some good punching techniques and so it's people surprise themselves, and you can take the real, but then give them the reality that they are still them and they can still do what they want to do.
Powerful.
And that they have a lot of control. If you take the diagnosis and it becomes you, and you stop exercising and stop living, you will do poorly. If once you kind of go through the stages of grief, that doctor's wrong, why me? I'm angry about it. And then people come out of the other side and they realize, I still hate that restaurant. I'm still not going back there.
I'm still mad at the Browns.
But then exactly. Yeah. Well, I'm an Eagles fan. So
okay.
We've had one spike of
you
good.
Understand.
We're not much better in terms of championship accumulation. But we empower people. We tell them that you really have a lot of control about how your life's going to be. And if you do some exercise and keep doing your thing, let us work with medications when it's time. Lots and lots of things we can do to give you good quality. So
there's that psychiatrist. You and I, before we started this interview, talked about how much of a role of psychiatrist you almost have to play small p, right? Because there is a lot of that, getting people to see their lives are different, but not.
Yeah, and that's basically my approach has been learned over the years in talking with people. I've learned immensely from the people who are doing well, and I've learned immensely from the people who aren't doing well. So I help people, who their doctor said. I mean, I remember I had a woman came in. She said, "My doctor told me I have about 2 years to live with Parkinson's." And I said, well, if you die in a car wreck in 2 years, then he's right, but not from Parkinson's. And she had just not heard anything about get exercising, keep doing this. You don't need to plan for, I mean, everyone needs to plan, but you don't, you've got a lot of life left and you want to have it be good life. And
so the lesson is to seek a specialist.
Well, right? I think the lesson is to, well, let me put it this way.
Okay.
I have worked with a lot of people over the years, and almost 20 years of working with people with Parkinson's, I have learned a lot from them. Yeah. I don't have it, I don't think, I don't know yet, but I've learned a lot from them. I don't know how they feel, but I know what they tell me, and I have learned how to take the accumulated positive information and tell people about how they can live their life, and that's very, very powerful. And so you can take a tough diagnostic visit and turn it in. People will often walk out feeling kind of empowered. I don't want this, but I do have a lot of power over this, and I'm not gonna let it get me down. And a lot of people around here do that, and they do quite well. And frankly, between a little bit of medication sometimes and the exercise programs, there are times when people walk in and I'm really nervous that I've misdiagnosed them because they're really looking pretty good. So yeah. So
well, you've given me like some hope. Well, we work, we do talk to a lot of people who've just gotten a diagnosis and are involved with the Parkinson Foundation here locally. And so I like the way I'm learning a lot from just the way that you're wording things.
There's an approach, and if you came to me to talk about arthritis, I wouldn't impress you. Parkinson's disease and some other disorders, it's really been what I've learned from working with people that has helped me to gently but realistically tell them what's going on, but then say, listen, I'm getting bad knees, I'm getting a bad back, I'm getting all these things. And so I also tease people, give me another 20 years and I'll really know what I'm doing, because that's not Parkinson's, that's age. But yeah, the experience is, you can really use that to help the next group to say, you're going to be okay. Because, there's a woman I met she was in her early 80s. She had been diagnosed in her early 60s. So she was about 20 years in, and she was an 80 to 85 age group champion 5K runner or something. I'm like, this is, we had a guy, we did a Spartan run, my wife, myself, and some friends, and a few people.
I don't know what that is.
Oh, Spartan, those are the obstacle course races you see on TV with the walls and all that. Now, I'm a participant. I'm the chunky guy in the back that the cameras will go to say, look, you can do this too.
Somebody's pushing you over the wall.
Exactly. But we had a guy who's a decade older than me with Parkinson's disease who am I allowed to say kicked my butt on the
Sure, yeah.
He was phenomenal. And so we're trying the pandemic knocked that down. Yeah. We're going to try to get that back. Yeah. But the point is, you're still you. You can get out there and do that stuff. We're doing Spartan races together. It's kind of fun.
You seem you're very positive, I can tell, as a person and not just a physician.
Well,
well, what keeps you up at night? You got some things in your mind that probably weigh on you a little bit.
I think the thing that with regard to Parkinson's, the thing that really bothers me right now, and now that I've spent about 7 years doing pretty much care of persons with these disorders, as opposed as a past academic running a lab, and changed for a variety of reasons, but for some people, and sometimes many people, there's a stage kind of late in the course of Parkinson's disease where the walking problems are difficult, and they are carried by systems in the brain that don't respond so well to the tools that we have, the medications that we have. People have to think really hard about turning, think about starting to walk, about stopping. And the kind of the automatic mechanisms that we have are having difficulties. I mean, people spend decades. Oh, I want that. I'm going to get that. I'm going to turn and get this.
Yeah.
We don't think about that.
Yeah.
But those automatic mechanisms start to have difficulty. And so we need to have kind of cognitive, I got to think about this turn. I got to think about starting to walk. And they're kind of stuck.
Yeah.
And they have to find ways around that. That is medication responsive, exercise responsive to a certain degree, but as things continue, those tools may not work as well on some people. And that is when I'm turning, but my legs aren't paying attention and I fall and I hurt myself. And so we do not have good treatments for that stage for those people. And that's when people fall and get hurt. And that's where I sit in the office just wishing that I had something better to tell them than the pills aren't going to work for this, and the therapy, we can help you with different tricks to break the freeze or to start hesitation or the turns. We can give you assist devices, but it becomes very intrusive and they have to think about it constantly. That makes them tired. And then if you throw in some cognitive problems and they're not able to think about this and to overcome the impulse to grab that soda can.
Yeah. And that's where the care partners, that's when it starts to become really hard on them.
Exactly.
Like, I asked you not to get up while I was going into the kitchen.
And that's
you're on the ground.
exactly right. And that's part of the disease process. It's not them being ornery, although maybe some of them. But
most of the time,
for most of the time,
they think they can do it because they have.
I'm just not. I don't have the brakes on it anymore.
Yeah.
So that's the part that really bothers me. I mean, all of this bothers me, by the way.
I get it.
But that's the part where I feel a little helpless, and I feel like I wish I had a better answer. There are interesting things happening in that regard. So to turn that again to the positive, there are things that I would like to do. I have been talking with some engineers and some scientists about ways to maybe use technology to automatically recognize and then deliver tricks to help people to walk. So that's early stage.
It's
something. It's the the old academic in me. We have some research trials now starting to go at Ohio Health that are very interesting.
Good.
And
so you're getting to see a problem and finding the solution. And that's...
Well, this problem, I'm seeing the problem. I think the solution is going to be tough, but there's some technologies out there that I think might be very helpful, and I would love to develop that. Cool. And I'm working on it.
So that's probably what excites you.
It keeps me up at night both ways.
I love it. Yeah,
so that's very exciting to me, because one of the if you generalize about persons with Parkinson's disease, they are very motivated and they want to help to find solutions. And so I think if we can put together some of these, if we can get some of these ideas together, we'll probably have some people that want to try things out because in my son's an engineering major, and dad's saying, listen, there is an area here that is a gap that we don't have treatments for, and maybe
look that way.
Maybe that would be something that he could kind of take the baton on. But that's the area that bothers me. Well, there again, the cognitive components, there are lots of things that bother me about this that I wish I could help people more on. But that one, just because I know that people can do little tricks, taps or wiggles. Some people will find ways to break the freeze. And so the simple doc here thinks, well, wait a minute, if you had a device that told the computer that you were having trouble getting your legs going, and then did a little zap or a little tap or a little something that wiggled your hips or something like that, acting as the trick that cognitively we're not delivering anymore, maybe that would break the freeze and get people walking and reduce the fall risk.
I
But
see it.
it's easy, as I tell people in the office, all of my ideas work on paper.
That's okay. That's where they start.
Right.
Are you or your practice taking new patients, if anybody watching is wondering? Okay.
Yeah, we
Good
have
to know.
a good movement disorders presence in
Good.
the Columbus
You do.
area, and we have 5 of those good docs in our group. And I know the Ohio State people, and they're wonderful people, very good doctors.
We're fortunate in Columbus to have so many people who understand the disease.
And we have very good exercise programs,
for sure.
quite a few of them in the area. And so yeah, it's we all do the best we can to help out, but the community is very strong here, and that's a positive.
Thank you. This was so informative. I really appreciate you being here today.
You're very welcome.
And thank you all for joining us at Live at Lunch with